Bertha Barrett, and I'm the host of Intake Talk Show. I'm also a mental health therapist, and today I just want to talk a little bit about the current pandemic with the coronavirus. Joining me today is Dr. Tashinea Bernadin, who is a DO, Doctor of Orthopathic Medicine. We're just going to talk about the current pandemic with the coronavirus. Dr. Bernadin will be addressing it from the medical standpoint, and I will address it from the mental health standpoint. You should also know that Dr. Bernadin is my daughter, and so we're just going to talk about some things and hope that whatever we say helps clear up some of the confusion and some of the stress that we're currently seeing on both of our ends. Dr. Bernadin, welcome.
Hey, Mommy.
How are you?
Good. First off, coronavirus is it's a family of viruses. So there are different types of coronaviruses. The SARS, this is, I guess you can say, a SARS coronavirus. If you all remember back a couple years ago, there was the SARS virus that was causing all the respiratory illness and respiratory syndromes. That is also a coronavirus. So now this is, I guess, a newer or a different type of coronavirus. When it first came out, it was called a novel coronavirus, meaning like a new coronavirus, because we were seeing kind of like a new presentation in regard to the coronavirus. And now it has been given the definitive name COVID-19, COVID, co for corona, vid virus, disease. 19 is the year that it basically came out. So the population that it is affecting, I mean, obviously anyone can get the coronavirus, but the population that is at higher risk for adverse events due to the coronavirus are the patients who are, or the persons who are older, particularly anyone over the age of 60. They are at a higher risk of getting really bad symptoms from the coronavirus. So that population is at higher risk, along with anyone who has any chronic conditions like diabetes or any autoimmune conditions, anyone who has any lung conditions, sarcoidosis, asthma, things of that nature, puts you at a higher risk of having more severe symptoms than someone who doesn't otherwise fit in that category. Treatment, we don't have a treatment for the coronavirus yet. It is a virus, so we don't have an antiviral medication for it just yet. There is some promise that a drug called Plaquenil or hydroxychloroquine, which is a drug that we use to treat different autoimmune conditions like lupus or rheumatoid arthritis. It's also used as a malaria prophylaxis. So anyone who usually goes to Africa or any country where malaria is still prevalent, we oftentimes will give patients Plaquenil or hydroxychloroquine for them to take while they're on their trip. So there is some reports that we may be able to treat coronavirus with this particular drug, but it has not been tested in human trials. I believe they tested it in vitro, meaning they tested it on a petri dish with just cells and the medication, and they saw that there was some promise. But again, you know, when you start human trials, you're not sure what exactly you'll get or what exactly will come of that medication as a source of a treatment. But nonetheless, we don't actually have treatment for it right now.
For me as a therapist, I'm constantly trying to encourage people that, yeah, it's good to stay informed, but don't be overly informed by, you know, sitting in front of the TV, you know, getting in all of this information about the coronavirus until your stress level is going up. And then if you have children in the home, they're watching you stress and cry and worry. And we know that children mimic what we do. So I'm very concerned with the anxiety, the public's anxiety, and how that is affecting, you know, the mental state. So from a standpoint, can you tell me, you know, what your thoughts are on that?
Definitely. You know, as a medical professional, I'm not a therapist,
Mm-hmm.
but patients do come in, and if they have depression or anxiety, and if I feel it's deemed necessary, I will give medication for it. So I see depression and anxiety on a consistent basis in my practice. But since COVID-19 has come up, I have patients, that's my husband, guys, interrupting my shot. But I have had a lot of patients who otherwise don't have anxiety or otherwise didn't have depression, where it's becoming a thing for them. And it's mainly because of the media. And I'm not in any way negating the media. I mean, they have to do their jobs, but it's causing a lot of people to panic and be in a frenzy. So I have a lot of patients who are afraid to come to the doctor's office because, of exposure. They don't want to be exposed, which as professionals, medical professionals, we understand, and we know who our at-risk population is. So we've taken measures amongst ourselves to decrease the anxiety levels in our at-risk populations, like the people who have diabetes or our elderly. We're trying to focus more on virtual visits. So basically telemedicine. Mm-hmm. So that's one way we're trying to kind of decrease some of the anxiety that might come with having to leave your house and go to the doctor's office because you need your medication, or you need a refill, or you have an issue and you want to talk to the doctor. So as a society, we're trying to adapt to address and to control people's anxiety, but there's only so much we can do. I know you touched a lot on the cortisol levels as a stress factor, or basically stress raises cortisol levels, which is very true. But a lot of people don't recognize that cortisol levels can also raise your blood sugar, raise your blood pressure. So those things are not good. So it is important to sometimes step away from the TV. I mean, obviously be conscious and be mindful of what's happening in our society, but also don't overwhelm and consume yourself with it. I think it is important to do some self-care things. So things that you enjoy doing at home while we are social distancing. It is important for you to take care of your mental health, whether that be exercising, whether that be meditation, whether that be doing whatever it is that you enjoy doing. I think it's important that you do that to keep those cortisol levels down, because the more you do stress, as mentioned, cortisol levels can rise, and with rise of cortisol levels can cause, a lot of other things, flares and autoimmune conditions like lupus. And it can cause increase the blood sugar and the blood pressures and things like that.
I think people should also understand that high cortisone levels also impairs their thinking. So it affects the brain. It impairs their thinking, it impairs learning, it impairs concentration. So when people just say, oh my God, I just had I'm going blank, it may have something to do with that, stress level. And we want to remember how important that is, because the children are home now, and a lot of them are doing virtual schooling. If mom and dad is walking around stressed and they're picking up on that stress, that may even affect how they're learning because they're still developing. And we want to try to keep their stress levels at bay as much as possible. And so it's very important that we keep it decreased by doing things, to keep yourself occupied. I know for me, a lot of people are fearing that it's the end of the world. Mm-hmm. That's the biggest fear. It's the end of the world. The world is coming to an end. From my standpoint, I encourage people to understand that the world has been coming to an end since I was a little girl.
Nope.
Yeah, it's been coming to an end for some years now. And so the best remedy is to be in the moment, to focus on now, to focus on those things that you can control. And the only thing that we can control is ourselves and our environment to an extent. And so that becomes a great factor in making sure that you're coping with what's going on. And again, not to become so overwhelmed. I've informed a lot of my clients to just step away from the TV, step away from the news, find one or two good sources that you can check in every so often and see what's going on, but you shouldn't be so involved with what's going on until that becomes your only focus. Because again, that's going to increase that anxiety, that stress level, and we don't want that stress level to increase. We just want to, we don't want people to be overly anxious because of the problems it causes in the long run. I just want to give you all some tips on some coping skills, the way to cope with what's going on. First of all, eat healthy foods as much as possible. Eat healthy foods because, again, food becomes our medicine. And it affects the way we think, it affects us physically. So eat healthy foods. Again, exercise, spend time outdoors, and stay in the present. Stay in the present. Think about, okay, where am I now? And how do I feel now? How is my family? Be in the moment. Realize that while this is happening, perhaps in your house, it's not happening. That you're okay right now. Reminding yourself that, hey, I'm okay, my family is okay, and staying in the moment. It's a good time to, do something enjoyable, that thing that you've been prolonging for a while, like maybe reading that good book, or going through some some family photos, and just be creative. So with the young people, be creative. Adults too can be creative. I know for me, I'm a big child, so I love coloring. If that's what you like to do, do it. I heard one of my colleagues say that they've been watching a lot of cartoons, and it's okay. Yeah. And so it's best right now, the best thing that you can do is stay positive. It has been scientifically proven that a positive mind state helps in so many ways. Again, if you're a spiritual person, you want to practice your spirituality because the power of belief is strong. If you don't know that, then perhaps you need to research the placebo effect. And it tells you about how powerful belief is. And so if you're a spiritual person, if you have, some kind of spiritual belief, I know a lot of people are buying these little stones to keep their energy high. Whatever it is that you believe in, it's a good time now to hold on to that, because the power of belief is really strong. And just think positive about this. And use humor. I know a lot of people are becoming upset because they're using a lot of humor on social media about this coronavirus. And while we're not taking it lightly, I hope people are not taking it lightly, humor really helps. So, taking things that, keep you happy. Humor doesn't hurt anything. As long as it's not offensive, because we do want to be conscious of the fact that there are people around the world who have died from this virus. There are people now who are suffering from it, and we want to be sensitive. And while we're practicing social distancing, we should not be practicing emotional distancing. Right. So we have to remember to be sensitive to the fact that there are people who are suffering from it. People have lost families, and there are people who are suffering from the virus and really don't know what to expect. And hopefully they'll watch this and know that, hey, positive thinking really helps. And so you want to find things to cope, practicing some breathing. Yoga is a good thing. If you can't leave the house and maybe you have a yoga video, I understand that they have yoga on YouTube. You can find everything on YouTube. Maybe meditating, doing some deep breaths to keep yourself calm. And with parents, it's a good time to teach the young people how to deep breathe. And the best way to do that is to place like a stuffed animal on their stomach and teach them how to take deep breaths in and out. And it becomes fun because they watch this animal go up and down on their stomach, but it really works. So find creative things to do, keep the stress level down, take a break from media, take a break from social media as well. The coronavirus is everywhere. People are talking about it. Take a break. It's okay to take a break, and just focus on the now. What's going on around you now? What can you control now? Because that becomes really important.
Symptoms of coronavirus is, I want you all to be mindful that it does include cough, shortness of breath, and fever. And fever in the medical field is a temperature that is greater than or equal to 100.4. So that is what a true fever is. If you are developing a low-grade fever or even, coughs and some shortness of breath, it is important to reach out to your primary care provider, and they can direct you in regards to what should be done next. A lot of offices are doing screening questionnaires when patients call in, and from there they determine who needs to be tested or who needs to be seen by a provider. So it is important to kind of be mindful of the symptoms that are associated with COVID-19. And if you do develop symptoms, contact a medical professional. And if you've been in contact with someone who have been confirmed as having COVID-19, then again, it's important to reach out to your primary care provider or someone in the medical profession to, discuss that and determine what the next steps will be for you.
If you feel extremely stressed, we call it chronic stress. And that is when the stress is ongoing. Acute stress that we all experience sometimes is a short period. It's like when you're sitting in traffic and you're stressed for that moment, but eventually it goes away. Chronic stress is when it is constantly ongoing. And you're constantly thinking and you're constantly worried and you're feeling this stress response happening in your body. If you feel like you're paralyzed with anxiety, stress, take easy, small steps to relax you and get you back in the moment. Focus on little small things that you can do to get you back into the moment, to take your mind off of what's going on so your stress level decreases. It is very important that we listen to what they're asking us to do. We've never been in contact with this before at this level. Is that right?
No, I will say this is a pandemic, meaning it has reached several different countries. No, we have as a country dealt with this, but I don't think it hasn't been many people who have lived through previous pandemics. For myself included, this is my first time experiencing a pandemic. I don't know that SARS had reached this level, but COVID-19, as you all see, it is getting up there. I think the largest pandemic that we have had in the past, several hundred years ago, was the influenza pandemic. And as you all know, that's a recurring thing. Influenza or flu virus is still a thing. We do vaccinations against that. I know a lot of people are wondering if there's going to be a vaccination for the COVID-19, and they are working on that. But that's something that will, take time. But as you all see with these viruses, influenza included, you all see we have flu season every year, and there's a new vaccine every year because viruses can change and mutate and, present a little differently. So I think it'll take time before we even develop a vaccine. It takes a while, but no, yeah, you're right. I mean, this is probably the first pandemic that many of us are experiencing in our lifetime, and it is. It's becoming a very big deal, and I think a lot of people are getting nervous because they're seeing the increase in numbers of COVID-19. But I think people are also taking into account that just means that there's increased testing. So obviously, the more people you test, the more positive results you'll get. A lot more people have it and don't have the severe symptoms. So a lot of the people who have it are being self-quarantined. A lot of them are not in the hospitals. And of course, the ones that are the ones that I mentioned, the ones that are at higher risk for developing more severe symptoms, which is that population of 60 and older and patients with chronic conditions that can already affect the immune system. So just keep that in mind. And if you can do your best, keep social distancing. It's recommended to stay about 6 feet apart from someone when you're, outside of your home. If you're going to the grocery store or anywhere, try to stay about 6 feet apart. Don't go to any crowded places. As you all have already been seeing, restaurants have been closing and they're only there for takeout only or drive-through only. So, just kind of be mindful of that. If you're someone who falls in that category, make sure you have family around that can support you and they can make your grocery store runs for you. I do see us in the near future going under a national quarantine like Italy. And I think Italy has been doing a great job at their national quarantine. I think people think national quarantine, meaning they're going to be stuck inside the house all day, every day, and not able to go to the supermarket. But I have a good friend in Italy, and I've been seeing her go to the supermarket. And while they're keeping their social distancing, they're still able to, do their grocery shopping. It's only a certain number of people allowed in the store at a time, but they get in and they get out because they want to let other people, have other people, give other people the opportunity to get in to the stores as well. But I do foresee us getting to that point, because that's the only way we're going to slow down the progression of the virus, especially to those who are at higher risk of developing those severe symptoms. So it is very important that we adhere to the recommendations. And if we are eventually placed under quarantine, it is important that you do quarantine. You do as recommended, and what's best for your family and for the nation.
Right. Thank you. Again, if you are experiencing high stress levels and you know it, be honest with yourself, and you don't know how to calm yourself, just remember that mental health professionals are out there. Talk to your primary care doctor too as well. They can help you with that. And like I said, it's very important that you decrease those levels. Right now, a lot of mental health professionals are doing telephonic or distance therapy. Take advantage of it. The government actually asks more therapists. Unfortunately, we don't have enough mental health therapists, but have asked therapists to step outside and do as much distance therapy as they possibly can because of the high increase in stress and anxiety. So take advantage of that. I know a lot of insurance companies are waiving the co-fees because they are aware that this is going on. So call your insurance company, talk to them about a therapist. If you can't reach out to one, they'll give you information, but reach out to someone who can help you decrease those levels and help calm you down. It doesn't hurt. I know we have a big stigma on mental health. Doesn't hurt, doesn't mean that you're crazy. It just means that you need somebody to talk to, somebody to guide you through what it is that you're going through. So I hope that this video has helped in some way and that we've covered all the bases, hopefully. But again, there are a lot of things going on. You can, always just, I think the CDC, I have been looking at them. They have a lot of great information on their website. They even have PDF files that you can download for children and adults about coping skills. Find these resources to really help you. And my dear daughter, I so appreciate you, and I thank you for joining me in this conversation and for the great information that you've given to help people understand a little bit more about, this virus itself.
No problem, no problem. And I concur. CDC, that should be anyone's go-to site. Don't just go off of what you see on Instagram or Facebook. Always go to CDC. They have the most up-to-date information on there, and be diligent, because things are changing constantly. So don't get frustrated if it was one thing yesterday and it's another thing tomorrow and a different thing today. But the CDC is going to give you the most up-to-date information. So that is the site that I recommend everyone visit if you must stay up-to-date on what's going on. That's the site. But thank you for having me, Mommy. I enjoyed it.
Yeah.